things. Okay, so I have another question. I'm going to read this for you. A 40-year-old woman presents with recurrent episodes of pruritic erythematous plaques for the past 2 months. Each episode lasts for several hours and then resolves without treatment. She denies any new medications, food, or recent illnesses. What is the most appropriate next step in the management of this patient? So we go back to assessment. Most appropriate next step in the management of this patient. Most appropriate next step. Are you going to initiate oral steroids? Are you going to perform a skin biopsy? Are you going to prescribe a second generation H1 antihistamine? Or are you going to order extensive laboratory tests? What are you going to do? What are you going to do? Honorable doctors, what are you going to do? Initiate oral steroids, perform skin biopsies, prescribe a second generation H1 antihistamine, or order extensive laboratory tests. What are you going to do? So, the correct answer will be C. C. You're going to prescribe a second generation H1 antihistamine. That is the first line for urticaria, right? Due to the efficacy and minimal sedative effect. Because this what's the next most appropriate next step? They are preferred over first generation antihistamines, and the reason is because first generation antihistamines can make people drowsy. However, why is oral corticosteroids not the next best step? They are generally reserved for cases with prominent angioedema or persistent symptoms despite antihistamine treatment. Right? Now, why is skin biopsy not the right answer, even though a lot of doctors went for that? A skin biopsy is not typically necessary for diagnosis urticaria unless there are signs which are suggestive of vasculitis. So if you have somebody with urticaria, when will you do skin biopsy? If the patient presents with urticaria plus some vasculitis. Why will you not do extensive laboratory investigations as the next best step? Remember, we are not saying you're not going to do these investigations, but we are saying what is the next best step? Extensive laboratory tests are usually not indicated in the absence of symptoms suggesting an underlying systemic disorder. So remember that expression, next best step. It does not mean that doing laboratory investigations are wrong. It does not mean that doing a skin biopsy is wrong. It does not mean that giving oral steroids are wrong. However, with the patient presenting this way who has not taken any antihistamines and the rest, the next best step is to give antihistamines and follow up with the patient. If it is progressively getting worse, then you can add a steroid. If the patient is still not improving and you are now suspecting symptoms of vasculitis with these symptoms the patient is presenting with, then you want to do a skin biopsy. Now, a 40-year-old female with refractory chronic urticaria and episodic abdominal pain reports a family history of similar symptoms. What is the most likely diagnosis? This one, the question gives itself away. But let's see. A, hereditary angioedema. B, chronic spontaneous urticaria. C, drug-induced angioedema. D, idiopathic mast cell activation syndrome. What is your answer? What is your answer? What is your answer, doctors? Fellow doctors of the noble profession, what is your answer? Is it hereditary angioedema? Is it chronic spontaneous urticaria? Is it drug-induced angioedema? Or is it idiopathic? And what gives it away? The answer is hereditary angioedema. And what gives it away? Dr. Tinili, no.
Family history.
What? Yes, the family history. Just that's this expression. Family history. That's it.